everybody, welcome back to the Brush with Brit channel. Today I want to give you a full tour of my operatory. I didn't clean anything up. This is just straight up how it is right now. This is by far one of my most favorite operatories that I have worked in. There are a lot of things that are great about this operatory. There are a few little things that I would change. They are very, very minor things. So let's get into it. I wish every single operatory had a window. I just feel like it makes just for a better vibe in the operatory. Then you don't feel so secluded all day long in the room. I have all of my trays set up here. So, you know, I did mention there are some things that I would change about the operatory. And one of the things that I would change is that this setup right here is set to this position. So no matter where I put the chair, this does not move. It can just cause some ergonomic issues. One of my most favorite things on this side is that we have two high vacs. So I am able to utilize the pure vac here and the relief system here and a saliva ejector. Being able to use two is definitely helpful, especially when you are using things with aerosols. And then we have our x-ray unit here. And then we just close this. There's the overhead light, which that pretty much just collects dust there because we all have lights on our loops. And then here I have some things that I like to give to the patient. So closest for the pre-rinse before doing a prophy or procedure. I like to give out water pick brochures, and then I will usually go on the inside and highlight which one I would recommend for them. And then we have the Sonicare toothbrush for going over OHI. These aren't usually here, that's part of the airflow. And then we have my cocoa floss jar, which I purchased this and got it custom made. There's not actual floss in there, so if anybody tries to steal this floss, this is literally just display, which it literally happens. In here is where we keep all of our instruments. So again, my coworker can get them from the other side, so this is a really cool place to be able to store your instruments and share them. Like a miscellaneous drawer where I just have some random things that aren't used too frequently. This side has things that I would need for like a doctor's exam, so high-speed handpiece, we have the endo eyes, triangles, the tape, barrier tape here. I don't really open that drawer too much. This is where I keep all of my trays, which I need to set up this morning, but usually I would have them kind of pre-made. Over here, more miscellaneous stuff. This is kind of my SRP kits. I have some Clin Pros there if those are prescribed. This is random tooth sleuth, bite block, stuff like that. This is more randomness here. Some backflow protectors. Down here we have a curing light back there, phone charger. These are the glasses that I wear when I'm cleaning the room. I got this from Amazon, little pen holder. This is cool for helping to diagnose cavities. Omron blood pressure cuff, also linked in my Amazon. Two pairs of gloves. We have doctor's size and my size, keyboard, mouse, and then underneath here, I have patient goggles, my loops. This is where I charge my loops. Some hand pieces there that I need to put away. My big cocoa floss jar, which is kind of crooked right here, so I need to fix that. Disclosing solution, hand sanitizer. Okay, that's that. Now let's go to the bottom. Oh, hey, settle chair. Patient mirror. Into this drawer, this is kind of miscellaneous, my keys, notepad, ear protection, dosimetry badge, a cloth for cleaning loops and some spray, and then some masks here. Going into this drawer, this is my like tray setup drawer. Fluoride, floss that I will, this is the one that I grab only if the contacts are like so tight that I can't fit the cocoa floss in. Bibs, gauze, relief, saliva ejector, and applicating tips, and then a backup of the Triplaque gel. Then we go into this drawer. This is my anesthetic drawer. Extra gauze, Q-tips, long needles, short needles, anesthetic. We have the sodium bicarb for buffering the local anesthetic. Topical, cotton rolls if needed, gingercane, And then these are needles to get the sodium bicarb from there. Cushions and my loop box. So I have this really gigantic one. I do tend to see a lot of geriatric patients, so this one is really great for that. And then this one is more standard. This is my toothpaste drawer. Then we have more toothpaste, mouth rinse, floss, toothbrushes, more toothbrushes, my coupons for Cocoa Floss, and some TheraBreath samples. Here we go into all of my goodies, my gum stimulators, my N-Tuff brushes. We have no, these aren't the soft picks. We have interproximal brushes. We have floss picks. We have these Reach. We have Super Floss. Here are the soft picks back there. So just tons and tons of samples. And then this is my mess drawer. I am literally out of breath. I hope you enjoyed the tour of my operatory. Love you guys so much. I'll see you next time.